you all. I see David has a question, and we invite anyone else who has questions to come out. David, why don't you go ahead?
So thank you all. I'm Dave Fukuzawa, Kresge Foundation. This question is kind of directed at Anand, but everyone is sort of talking about this bipartisan kumbaya around obesity. And notwithstanding what Joe was talking about, issues keeping us from coming together, what's stopping like BPC or others from just asking for some kind of task force under HHS to do this kind of a thing? Is that a possibility? I'm just curious.
I think it's a good question. We have tried to, at BPC, weigh in, and actually we had put forward a transition memo to the transition team, and that was our first item there. Of course, task forces only get you so far, and we have lots and lots of commissions and task forces and all, but at least it's a step, it's a sign, and I think, so I think that piece is important. I think one more point I'll make is I think having the right policy is one thing, going back to what Joe's saying. Policy implementation is another thing. And so there are a lot of things that, for example, task force could look at. Making this a priority, coordination across the agencies, do we have the right policies, and then how you implement them. So I think BPC has, David, and I think we want to continue to press that. And I think if other organizations, also looking at it from a bipartisan perspective or a nonpartisan perspective, want to either push that or different angles of that, I think that'd be great.
Can I just follow up with our representatives from the Hill? I mean, I think one thing we always find is there is what an outside group might recommend in terms of a new initiative like a task force such as Anand's recommending, but we often do better and achieve more change when we intersect with some ongoing work that's already happening. So, for example, we mentioned the Senate's Chronic Care Working Group, and we have looked hard at existing opportunities where members are already engaged on issues that they care about that may or may not carry the label obesity, but that would enable them to engage on these issues. And I wanted to ask our Hill representatives if they could go a little deeper, push you a little bit, about some specific opportunities that you might invite this audience to think about in a concrete way. So there's the Treat Obesity Act that you mentioned dropping yesterday, but other than that, are there particular either priority issues or moving activities that you think a group like this might have the potential to influence?
To show you how important these type of events can be, when you talk about having a task force, the first thing I do is Lynn and I look at each other and go, maybe that's something that we should write a letter to the president about, looking at something like that. So I mean, it really, those ideas are important and come to us. And I do think that coordination is, across agencies is important. I know Dr. Cassie said to a meeting with the Obesity Society yesterday, trying to get CDC or NIH to focus on obesity-related research and funding it is very difficult. And you talk about Joe was talking about, getting advocates engaged. Most people sit there and they go, well, if they have someone who died from, say, related to complications related to their diabetes, they focus on that. They don't look at the underlying condition that may be contributed to the diabetes. And so I think that it is caring by having that coordination and focusing on the fact that we can't just treat the larger symptoms or chronic conditions that are outreaches of the fundamental thing that is causing those conditions, and that's obesity. And I think we need to carry that message, and to have a task force and coordinate it, I think would be very helpful. I think there will be the Chronic Care Working Group, I think is a good opportunity to engage in innovative care delivery models and other barriers that might exist. I think that there is a desire to, as you're looking at Medicaid and others, to give more flexibility to states to experiment with different opportunities to do targeted population health management. So I think that is, as we're looking at how to give states more flexibility, that is an opportunity as well. But I think we really are looking at any and all ideas for how we combat this epidemic. But it really, I think, does start by raising the awareness with members to say, these diseases are all important, but wouldn't it be great if you could get at the underlying condition that is causing all of that? And I know they've done this sort of in the neurology space. They focused on the brain initiative, and they brought all of the groups together that are focused on different neurological diseases, because they realized that if they came together and focused on sort of this is a part of the body that is infecting all of this, and we don't know where the research is going to take us, it could help on all these different diseases. We need to do something like that, focused on obesity and the fact that it is contributing to all these other diseases.
So I would just agree with everything my colleagues are saying. I don't want to sound like a broken record with anyone, but I think I would just offer 3 points, and some of them are diverging and some of them are more practical. The first I would say is, to the extent that you are talking to your representatives, and I urge you to do that, because I think, as Joe was saying, when you come in as a patient or a provider or someone who represents the community, you speak with an authority that's different than, quote unquote, not to be disparaging, but like a quote unquote talking head or an academic. I mean, if you are coming from someone's community, they automatically care a lot because you're a voter. The second thing I would say is, to that point, is like, know the statistics about your areas. Bring the stories about their neighbors. Talk about whether your community has a 20% overweight rate or a 30% obesity rate, and what are the factors driving the obesity trends in your communities. And I think those are the types of things that sort of help members get more engaged when they sort of see how something that they could do could really affect their local neighborhoods and their friends and their families and their schools, all of that. The second thing I would say is on this Medicaid issue that some of us have talked about. I think we have an issue with measurement in our healthcare system in general. My boss likes to say, you can't manage what you can't measure. I probably said that wrong. He says it more eloquently than I do. But his bottom line is saying, like, if we don't really know where our baseline is, then we can't figure out how we get better, right? And so we know that we're not doing a good enough job in Medicare and getting folks access to counseling. I think that is probably doubly true in the Medicaid space. We have no idea what our levels of counseling are in Medicaid, and the states are not at all really encouraged to measure and make a dent in that problem. So I think I would encourage you all to sort of think big and also think about basics, like how we can really make a difference. My boss likes to talk about root causes and trying to address our healthcare costs by tackling our root causes. I think, as some of us have said, obesity and smoking are the 2 largest. And so if we can't figure out how we increase access to obesity treatment in Medicaid and tobacco cessation in Medicaid, our healthcare costs are never going to get to a manageable place. On the issue of a task force, I would just say, I look to all of you because I think that my vague recollection is that there has been efforts at the Health and Human Services Department in the past, even within the last 20 years, to look at the issue of obesity and to try and pull people together. And I think it's still a great idea. And I think it's something that we should definitely think about. It's just a matter of sort of, let's not put a shiny name tag on something and be like, okay, good, we're done. I think that we're all past that point now, right? We have legislation, we need more legislation, we need more people engaged, we need more champions. I think, that said, I think even looking at the idea of a task force or how to make something permanent within HHS so that we don't take our eye off the ball, even maybe looking at, a congressional commission, sometimes that can carry a little bit more sway, and see if that, and it doesn't cost a ton of money, to see if that's something that we could do, because I think this is such a huge issue that touches on so many areas, and I know that you all have talked about that at length today. I think in some ways Congress probably needs some advice on how we get at all of these broader issues. And so, whether it's a task force or a commission or something equally snazzy, as long as you all have put your heads together and told us the right questions that you think we should be asking with something like that, and the best way to make sure that that's something that's not fleeting, so that we don't do something in 2 weeks and then lose it, because we're fighting a war and there's so many countless things going on. I think that's really what we could use advice on, because I think we want to make sure that this is really integrated into every single piece of our policy-making apparatus and policy execution and implementation.
Thank you. Mr. Ray, another question.
I have a question for Matt. First, let me start by saying most of my career I spent as a physician scientist and did basic research, but I did see patients once in a while, and I've had patients who were CEOs of multinational corporations, tens of thousands of employees who couldn't control their weight. It was the only thing they couldn't control in their life. So another experience I had was when I was running Pennington. I met quarterly with Bobby Jindal, who was our governor, and I asked him for money to support obesity. He said, obesity is a problem of self-control. It's a problem of lack of willpower. And when I met with Bill yesterday with you, I picked up that stream of thinking again. And it made me think that there's a pervasive idea among people who are affluent, highly educated, normal weight, who think obesity is a lack of self-control. And there may be some element to that, but how do we educate politicians more to really get them to think about this is a very complex disease? And I think we have to push that thinking forward, not just in the scientific community, which most of us are in, but in the political community as well. That's my thought.
I think it is a big barrier. I think that there clearly are lots of contributing factors to obesity. In some cases, there might be an element of self-control. There are other cases that are, even more systemic. Or it could be genetic. It could be environmental. I put myself in my own shoes because that's the easiest perspective I can go from. There's a fact that with a lot of males, females often have a continuous point of contact within the healthcare system because of, they have an OBGYN. Males, after they get past sort of their pediatrician, immediately sort of lose a point of contact in the healthcare system. And and then they go to college and they drink a lot and they eat a lot of pizza and they do whatever it might be. But they aren't educated in terms of, there are fundamental societal elements that are contributing to that as well. But I do think that it is something that we have to combat. And recognize the different contributing factors. And I don't know that there is a magic answer of how we combat that stigma that clearly does permeate a lot of people's minds, other than to illustrate its connection to all of these other diseases. Because I think that there is an element where people are not making that connection. I think one thing that Dr. Cassidy did say that I think is important, and I think this is just a matter of maybe the way Republicans and Democrats tend to approach issues differently. There are some common elements, but they approach things differently. And I think that from Republican standpoint, often we might fall back on the sort of the financial, monetary element of it, and not necessarily the emotional connection for whatever reason. And that's a broad generalization. But if you're able to sell with a lot of Republicans that, look, here's the connection with a lot of other diseases. This is the financial element and how it is contributing to our healthcare system in terms of how it's contributing to the rising costs from an individual standpoint and a societal aspect. And that we know through this data, through recognizing the impact and the scope of the problem, that earlier intervention and these types of innovative tools leads to better outcomes when we go to the outcome measurements, that will save taxpayers and individuals significant amounts of money. That's something that resonates with Republicans. And I think sometimes it's a matter of tailoring your message and understanding who your audience is to get them on board. And Lynn could probably speak to what maybe it is that is going to resonate with Democrats more in terms of that connection to recognizing the importance of addressing this disease and condition.
I just want to say that everything Matt said would have resonated with my boss. So there is common ground there. And I'll just make a plug real quickly. I think one of the few, and you please correct me if I'm wrong, I think that one of the few bright lights that we've seen in some of this space is among childhood obesity. I don't know if that trend has changed. I hope that is not. But I will say, and I know Representative Nemours was in the room earlier, that is a home state constituent of ours that we love dearly. And they have been pioneers in the childhood obesity space. And I think that there is a lot of room, and I think that a lot of room to work together there is what I want to say. And I think there's different elements that go into childhood obesity relative to adult obesity, right? And to the extent that we can focus on folks that are younger, it's interesting to me as a mother of 2 little children to see what I hear about in the policy realm from folks like Nemours, and then see it translated to when my children come back from preschool and talk to me about healthy eating and tell me they like to eat, like raw snap peas as opposed to cooked snap peas, but they actually know what a snap pea is. It's like, I think there are actual real progress that we can see manifested day to day that we can sort of pull on and build on. And I think I just don't want to discourage anyone, because I think even though Democrats and Republicans sound like they're coming from far apart sometimes, I think there's an enormous level of common ground. There's an enormous amount of agreement that we have to do something here, and there's an enormous amount of agreement that, look, we may not be able to deal with agricultural subsidies. That's a really broad and difficult issue, and there's a lot of, whether you believe in a beverage tax or not, that's another issue. But there's certainly agreement that we should we should figure out a way to get everyone to eat more vegetables and get everyone more access to vegetables and fruits. And I think when you start from kind of that perspective and then you build in the fiscal responsibility piece, both for individuals and for the government, I think that's kind of a winning message that we should all try and work towards.
If I may, just one quick comment, Steve. I think one of the other things I would challenge you to do is next time you bring that CEO with you, right, and you have them share. When we turn this into real people, it's a lot easier for those legislators to listen, right? It's you're great with your history and your steam, about to be the president of this obesity society, but it's actually your patient who can directly relate, who probably will convince the boss here, the legislator, that this is a real thing. So I would just challenge you when you do that. Many of you, through the programs you run, have wonderful stories. We saw examples of wonderful stories here, which was amazing. Bring those folks with you to the Hill. That's what will change someone's mind. They will remember that person and that person's story more than they may remember the specific issue you were talking about, and that'll change hearts and minds.
So I want to thank the panel. We heard a lot about barriers and opportunities, but also how we translate some of this more academic thinking into what it means for real people, both patients and also members of Congress and policymakers to whom we ultimately would like to appeal. So thank you all. We are going to applaud you in a second, but I'm going to tell you that we are having a 15-minute break. There's coffee and tea in the Great Hall, which is that way, and we'll reconvene at 3:30.